The Health Insurance Act for AB 118. So every person that is a resident of Ontario is entitled to become an insured person under the Health Insurance Act. It is everyone's individual responsibility to make sure that they establish their entitlement to be or to continue to be an insured person. And so basically, what that means is we're responsible for renewing our health card, right? And initially, there was responsibility on our parents for registering us to obtain these health cards, right? So, when someone receives transportation by an ambulance in Ontario, in fact, they are billed by hospitals. So, you would think logically that it would be the EMS service that's doing the billing, but that is actually not what occurs. So, it's a little bit counterintuitive, right? Typically, for someone that becomes an inpatient in the hospital following the transportation, the billing's done the day after arrival. Outpatients, then they're billed just according to hospital billing procedures. But, we've talked about standard operating procedures in EMS services. Well, they'll have some SOPs in the hospital related to the billing, right? So, yeah, when someone gets their bill for ambulance services that were provided in province, they're going to actually receive the bill from the hospital. So if someone is transported to our local emergency department here in Thunder Bay, they will actually receive the bill for ambulance services from the Thunder Bay Regional Health Sciences Center. So, a little bit, again, counterintuitive, right? So, in fact, if there is billing required for any land or air ambulance services that originate out of the province, then that's done by the provider of the ambulance service. So, this would be a circumstance where someone's injured outside of Ontario and they're being brought back to Ontario, for treatment or repatriation or something like that. And so, this is a different type of billing according to the legislation. So this little blurb that we have from the legislation here, it says, where in-province ambulance services are provided by air or by rail, including, where applicable, any ambulance service required to connect with the air or rail facilities, an insured person shall pay his or her share of the ambulance charges, an amount of $45 a trip by way of co-payment. And then we have reference to the particular piece of legislation and the area of the legislation that this has come out of. And so again, this is from that Health Insurance Act, right? And really what this is telling us is someone that's being transported in the province that requires these air ambulance services, they're only going to be billed the amount of $45, right? And also, you can see in there that they're discussing if any land ambulance services are required to get the person back and forth. Again, it's just going to be that $45 fee. So it's not going to be $45 for the air ambulance, 45 for the ground ambulance. No, it's that $45 fee. And we do see the inclusion of rail facilities. So in the event that rail facilities were used, then that would fall under this as well. But of course, we understand that's not, sort of our normal process in Ontario typically, right? Now, there could be a situation that arises where someone that is a resident of Ontario and they do not have a health card and they make what is deemed a unnecessary EMS call, and that would not be in the opinion of the paramedic. This would be a physician deeming the ambulance service medically unnecessary. Again, this is someone who is a resident of Ontario, but they don't actually have a valid Ontario health card, or we can have that situation where they have that valid health card, but the physician has deemed that ambulance service medically unnecessary for them. And their ambulance trip has to originate in Ontario. So this is different than those ones we were talking about that originate outside of Ontario, right? And that as long as it originates in Ontario, the destination has no impact on this. So in these particular circumstances, then the co-payment charge that the person is responsible for is actually $240, and that's for each land ambulance service registered. And they can also be billed for the actual cost of each air ambulance service that's rendered. Sorry, and so those costs are quite high, right? When a aircraft is mobilized, you think about there's the paramedics on there, their salary, there's the pilots and their salary, and then of course there's all the operational pieces that are keeping that aircraft going and that service running, right? So so this is again that circumstance where Either somebody doesn't have that valid Ontario health card, or the physician has determined that it was a medically unnecessary ambulance trip, right? So, if you are a resident of Ontario and you require an ambulance that originates outside of Ontario, then you have to pay the full cost of the land and or air ambulance services that are received, right? So under the OHIP program, right, the Ontario Health Insurance Program, then land and air ambulance services that originate out of province, those are not considered an insured benefit, right? And so this is why it's important, if we're traveling outside of the province, that this is just one example of the reason that it's important for us to have private health insurance, right? Because in some circumstances, private health insurance can fill this gap where OHIP is not covering it, right? And they may actually offer some emergency medical or repatriation transportation when you're outside of the province. So when someone is visiting Ontario from a different province and they actually are insured under their own province's healthcare plan, and a physician has deemed that that ambulance service was in fact medically necessary, and they're transported between an Ontario hospital and a hospital in another province, or between two Ontario hospitals, so like transfers, calls that we would typically think of as transfers, and the trip is for diagnostic or therapeutic services, and they're returned to that origin hospital within 24 hours, then their transportation costs for ambulance are fully covered. So again, this is that circumstance that we would typically think of as being a transfer, right? Patient goes from one facility to another in order to have treatment or assessment, and then they're subsequently returned to that original facility that they came from, okay? So, if all of those circumstances don't exist and a visitor from another province then requires an ambulance, then they're actually going to be responsible for an ambulance service copayment charge of $240. And again, that would apply for each land ambulance service that's rendered. So, every time they need an ambulance, and then also the actual cost for the air ambulance service rendered if that's applicable, right? So again, this applies to someone that is in fact insured in their own home province, but they're not meeting the criteria that we looked at previously, right? That basically make it, like I said, a medically necessary transfer, right? So this would be a circumstance where they need an ambulance, for example, because they've had an emergency, right? And so they're calling 911. So, of course, we also have situations where we have visitors from other countries that are injured or fall ill when they're in Ontario, right? So, for these particular individuals, they're responsible for the full cost of both land and air ambulance services rendered, right? So when we've seen, with Ontario residents or residents of other provinces, we have seen some coverage, some level of coverage, right? It varied between those two different types of patients, but we have seen some level of coverage. Whereas with the visitors from other countries, there isn't any coverage, right? So we're now seeing the full cost of land ambulance services, where typically in the other example we were only seeing that full cost of air ambulance services, right? We were seeing co-payments otherwise for the land ambulance services. Now, there are exemptions to the need to make co-payments. So anybody in Ontario who is an Ontario resident who is insured under the meaning within the Health Insurance Act, right? So basically, again, has that valid health card that we recognize, that green one that we saw at the beginning of the presentation, then they are required to pay a portion or a co-payment, right, of the ambulance service that's rendered. So that is $45, right? So this is your typical standard patient that you're going to see in the field. They're going to be billed $45, which, we understand that that's significantly less than it actually costs to mobilize these ambulance services. Even when you look at that co-payment that we talked about for people from out of province of $240, right? That co-payment is significantly less, again, than it actually costs to mobilize an ambulance, right? So there are a few exceptions, though, where people that are Ontario residents that do have valid health cards won't be required to actually pay this co-payment. And it's important for us to be aware of these because sometimes we'll encounter patients in the field, as we've talked about, who have different socioeconomic factors that may be impacting their decision making in regards to accepting care or transportation, right? And one of those that we've talked about is, fixed income and finance finances, right? And so, if you have a patient that is hesitating to accept care simply because they're concerned about the fees associated with it, as a paramedic, having some knowledge about what the fees are and the fact that, they're reduced for everybody to $45, but then furthermore, there are some exceptions, which we're going to talk about in a minute. This can actually help you in those conversations where someone is refusing service, for that reason. Of course, in your conversation with the patient, you need to be cognizant of that. And so, you can explore that option of whether or not a fee is an issue for that patient and part of their decision for refusing service, right? That can be part of that conversation that you have, that detailed conversation before you're considering refusal of service with someone. So these exceptions are if someone is receiving benefits under the Ontario Works Act, the Ontario Disability Support Program, otherwise known as ODSP, or under the Family Benefits Act. So under these other pieces of legislation, if someone's getting benefits, they won't be required to pay that $45. And these people are on fixed low incomes, right? So again, these are patients where this information could be super relevant as you're trying to engage them in accepting care and transportation, right? So if they're receiving social assistance, right? So again, in Ontario, we're looking at those would be benefits under that Ontario Works Act, right? And then under the Family Benefits Act, there's also some. If the person's being transferred, so that situation where they're going from facility to facility, right, for that medically necessary treatment, then there'll be no billing for that. So this person is already in the healthcare system. Remember, they're an Ontario resident and they have that valid health card, right? So there's no billing for that process. And that's different, right, than what we talked about previously when we talked about the people that are not from Ontario, right? The people from the other provinces. You'll recall that there was some billing in those circumstances, but again, it wasn't the full cost that was being leveraged, right? We saw that full cost being leveraged with the people from out of country. Oh, I think there was one example there I bypassed. So the other example is if someone is basically living in sort of a home care setting. So someone's enrolled in the Ministry of Health's home care program, then they also would be exempted from that $45 copayment. Oh, and so when we look at the home care program that we were discussing on the other slide, right? That means basically that this person is living in one of the facilities that we see listed here on the slide that's licensed or approved by the Ministry of Health and Long-Term Care. So that would include a nursing home, a home for the aged, a rest home, a home for special care, or someone that is in a home or a residence for psychiatric patients. And so in the Health Insurance Act, in Regulation 552, it specifies that anyone that's transported in an ambulance is responsible for any ambulance charges, right? But as we've mentioned, there are exceptions to charges being leveraged, right? There are exceptions to the co-payments that exist. So again, within the legislation, it's recognizing that when someone is accepting transportation in an ambulance, then they are also accepting the responsibility for those costs, right? And as we know, of course, providing that someone has the consent the capacity to consent or refuse, right? And there are particular guidelines that are met. People can refuse service, they can refuse transportation, right? And so if someone does refuse service, then they're not going to be responsible for that those transportation costs, right? So they're not going to receive a bill. So again, this is one of the big reasons that it's important for us to know about the billing, is so that we can have these conversations with patients and reassure them if there is a concern about the billing, we can reassure them about what's going to happen, either if they fall into that category of being one of the people that's exempted, or if it's a very reduced fee, that $45 copayment is minimal, right? So again, important for us to have that information so we can empower our patients with that information as they're making these decisions, right? And so so as I mentioned, anyone that is signing that refusal of service, that is following through with that process, then they do not receive a charge. So, we do have circumstances sometimes where we're transporting more than one person in the ambulance, right? And so when that happens, in fact, both individuals will be responsible. So, if both of the people were Ontario residents with valid health cards, then they would be charged the $45 copayment, right? Assuming this is medically necessary. And so they would each get a bill for that, right? So the total for that actually would be billed $90 between the two patients, right? And yeah, so the other thing then, of course, is that the distance or the number of patients in the ambulance, it doesn't actually change that. So there is also some common misperception that there's changes, depending on the distance that someone is traveling. But the copayment, it remains the same. It remains at that $45 again, as long as they meet that criteria that we've discussed, right? So really, this legislation, it's all about billing, right? Who pays what, under what circumstances, and who's billing for it. So, like I said, the really big applicability to us as paramedics is to be mindful, because these will be things that are concerns to our patients, right? And so by having this information, then you're empowered to participate in those discussions. And then it's also information that is important for you to have going into your provincial examination. So, as always, if you have any questions or comments or feedback or concerns about the content, you can reach out to me through email. You can discuss in class, or you can book into my office hours.